Hi, everyone. I'm not Lori Fleming, but I'm Denise Banker.
Hi, Denise.
Hi. Hi, Lindsay.
I remember the days you used to be me.
I know I used to be Lindsay Scalf.
We used to share for everyone who wasn't part of that. We used to share a Zoom account, and we would just stay Lindsay Scalf. Sometimes we were both in a Zoom at the same time, both as Lindsay Scalf. And I am a Gemini, so that makes sense.
It made perfect sense. We were having the older version of Lindsay Scalf and Lindsay Scalf in her younger days. Hi, Chief Black. Hi, Chief McKern. Hi, Anya. Hi, Jim Novelli. Hi, Siobhan.
It was nice to see you in person in the wild a few weeks ago.
Oh, yes, in the wild. And I was
in the real world.
Oh yeah, I was with my brother-in-law. I was trying to remember let's see, where was that? I was with my brother-in-law. Yeah. He was visiting from Oregon.
Nice.
Yeah. And it was nice to see Tonya also. Am I saying her name correctly?
Tanya like Anya.
Tanya. Okay,
yeah.
Great. I thought it was Tanya, but I thought someone, it is spelled Tanya, obviously, but someone else had told me it was said it as Tonya, and I thought, okay, well, I'll try that.
It's spelled differently than some people spell Tanya, but it's Tanya and Anya. So that's your trick to remember it.
Well, maybe we just established that I don't know how to spell Tanya.
I don't know. I think there's some people just spell like Anya with a T, I think, but she's Tonia. So some people say Tonya, but she pronounces it Tanya. Yeah.
Okay, we'll give it a few more minutes because I think a few more people will arrive. And it looks like Matt is still trying to connect to audio. Can you see my screen, everybody? Okay. Hi, Jim.
Hello.
Hi, Brian.
Hi Denise, hi everyone. You're going under the guise of Lori, I see.
I am. Don't compare me. I showed up at 2 meetings yesterday and Lori shared the host for this meeting with me. And so then I had to sign into Lori's account. And so then I was in 2 other meetings, one this morning and one yesterday. And the one yesterday, I didn't know I was going to show up as Lori. And then I was looking at the people who were in the, who were on board at the meeting. And I thought, oh, Lori's here. It was me.
It's good to see you the other day. Both of the kids fully vaccinated, very excited about that. Thank you to Public Health.
Yeah, well, thanks for coming in, Brian. Really appreciate it. And it was great to see you. And it was great to see those 2 little ones because soon they'll be, 3 years old, then they'll be 4, and then they'll be 7.
I know, yep, they grow quickly. Yep. We brought them to Recovery Cafe's open mic last month, and we may again tomorrow night. This is a plug for all of you guys sitting here tomorrow, 6 o'clock, open mic night here.
Well, so why don't we get started? And if more people trickle in, that will be great. And maybe we are just seeing, the effects of this transition a little bit. But we'll see. We'll ride it how we have to, even though none of us want to see the transition. So just going to take a few minutes to do our introductions, and then we will let Anya do an update on communications and engagement, and then we will have the 1115 renewal waiver overview. And then I have just a few things as Apple Martine to say about our milestones data report. And then our next meeting, of course, is September 8th. And hopefully we will have some permanent person who will be doing that work, running these meetings, because I won't be here. I will be in Germany learning German. So without further ado, I am Denise Banker, and I'm the Community Health Division Director here at Jefferson County Public Health. And Lori has asked me to be the host for this meeting in lieu of Apple being able to be here because she is on vacation. And so Lori has given me a little bit of update on what to expect from this meeting today. And I've been a member of the Behavioral Health Consortium since its inception, so have been coming to these meetings all along, and was the editor and applicant for the HRSA grants that we've received. And so I know the scope of work very well, and what we've been doing. And I am sorry that I won't go into that right now. I'll just pass it on to Anya.
Thanks, Denise. Hi, I'm Anya, and I'm a social worker, and I'm a contract consultant with the Behavioral Health Consortium working on overdose education and prevention, and I'll give you more of an update soon. I'll pass it to Lindsay.
Hi, my name's Lindsay. I coordinate the Community Prevention and Wellness Initiative grant in the Port Townsend School District, and that is the grant that funds the Empowered Teens Coalitions in Jefferson County. So we have counterparts to the coalition in Quilcene, Brennan school districts, and Chimcombe School District. And then I'm in Port Townsend, of course, and I'm based out of Jefferson County Public Health. And so in general, I do adolescent substance use prevention. And I will pass it along to Brett Black, who's next on my screen.
Brett Black, Fire Chief for East Jeff and Port Ludlow.
Tim McKern.
Chief McKern, Quilcene Fire Rescue, and the Brennan Quilcene Empowering Teens Coalition.
Yay. Jim Novelli.
Jim Novelli, Executive Director, Discovery Behavioral Healthcare.
Thanks, Jim. Brian,
Right at Dove House Recovery Cafe.
okay, Brian, you're cutting out just a little bit, so I'm going to say that again. This is Brian Richardson, and he is the director at Recovery Cafe, and that is a division of Dove House. Braden,
Hi, I'm Braden Torgler. I'm the interim project manager for the Real program.
thanks for being here, Braden. We appreciate the work that you're stepping into.
Thank you.
Matt,
Hi there, this is Matt Reddy. I'm one of the Jefferson Healthcare Hospital commissioners, and yeah, very happy to be here.
Matt, we're very happy that you're here and that you're representing the hospital for us. Jolene,
Good afternoon, Jolene Crone, Deputy Administrator, Clinical Director with the Salish Behavioral Health Administrative Services Organization.
thanks so much, Jolene. And Ms. Brown, I am not going to say your name wrong, so thank you.
Hi, I'm Siobhan Brown. I am a Senior Program Manager in the Health Systems Innovation Team at Community Health Plan of Washington, and I'm joining you as a guest today.
Thanks so much, Siobhan. So without further ado, I think I am going to pass the mic over to Siobhan. And do you want to share your own PowerPoint, or do you want me to just scroll down here? Because oh, wait a minute, I'm sorry, back up, Denise. I'm not going to do that yet. I'm going to move on to Anya, who's next on the agenda. Anya is going to update us on communications and engagement. So
Great.
Siobhan, just 5 more minutes.
I'll be brief. Thank you, Denise. Let's see what's on my slide. So I think that all of you should have gotten a copy of the Overdose Awareness Day flyer from Lori. Brian, I dropped some off at Recovery Cafe, so hopefully you have those. If anybody needs more, I still have more printed ones, and I'd be happy to leave them for folks. So please reach out. And as a reminder, that's at the end of the month on Wednesday, August 31st from 3 to 8 p.m. All are welcome. It's not a recovery event. It's a community event from folks, even if they're still active in use or family members. I've been organizing pretty closely with Gabby, our colleague from Believe in Recovery, and she's been setting up some folks to come speak. So if you know community members, or if you yourself might want to come and say a few words, please feel free to reach out to me and we can plug you in, and coordinating to have some snacks and food there, as well as free naloxone. Quick update, this month additionally, we're going to be distributing naloxone at the Jefferson County Fair. Holly from the Quilcene Empowered Teens Coalition is going to take 100 boxes down and have that at her booth there, so really grateful for her. And then on, I think the 26th, the weekend before Overdose Awareness Day, there's a big music festival at Fort Worden called Thing Fest. And I'm going to be tabling there as well, distributing naloxone. That's what we've got for August. Coming up in September is Recovery Month. So there's some events being planned that I hope to be present at and do some education and outreach. And if you or your organization has things coming up that you would like me to participate in, or if you just want naloxone to distribute yourself, feel free to reach out to me and I'd be happy to coordinate with you. I also wanted to update folks on the right side of the screen. You can see the new behavioral health logo that local artist Shannon Kidd made with Lori before Lori left. So that's a logo that I'll be putting on things like the Overdose Awareness Day poster if there's coalition events that we're planning. And if you want a copy of that logo, I can get you that file if you want to add it to anything that makes sense. Yeah, and then protocol for BHC members to participate in the BHC communication and engagement effort, just reminding you that I'm a resource for all of you. And so please reach out to me directly. I can fill my email in the chat in a moment. And I'm here to support events or ideas for events that you have, or to collaborate together. And I'm working on kind of typing up some more specific like written policy that I can work with Denise or Apple on. So we have that in writing too about how I'm doing reporting on numbers and things like that. Does anybody have any questions or feedback or anything? All right, thank you.
Thank you, Anya. And then the only question or thought I had was, will anybody be at the All County Picnic, which is August 20th? Saturday, August 20th. I know that Public Health has a booth there, and so maybe I could talk to Ocean and see if they're doing anything, and if so, maybe if you or someone that you're working with has the bandwidth, maybe you could show up with some naloxone for that event.
That
But
sounds good. I didn't have that on my calendar, but I would definitely want to support that event. So I can also, I'm in communication with Ocean too, and I'd be happy to, to use the behavioral health naloxone supply that we have if they need some extra kits to distribute. So that's a great idea. Thank you.
okay, yeah, absolutely. And Production Alliance is also the one putting this on, and so like Thing, they're completely involved in it. And so if you reach out to Ocean and let them know, and they said, yeah, that's a great idea, then you might also reach out to Production Alliance and let them know.
Awesome. Yeah, I have Danny Milholland from Production Alliance's contact, so I'm sure he would be happy to have us there. Yeah.
Awesome. Great.
Thank you.
I'm glad I mentioned it. I was just going to go on and not, but I'm glad I did.
No, appreciate that. And yeah, if any of you have ideas like that in the future, just don't be shy and please reach out.
Thanks, Anya.
Thank you.
One thing I was thinking of, it's the same day, but Family Reunification Day is happening on August 20th as well. And that's at the Courthouse Park. And I don't know if that's, yeah, I'm not really sure if they're going to have, tabling events necessarily, but Denise and I are going to be there that day. And that's just what came to mind, but.
Awesome. Another thing that I've been doing, if I can't be in multiple places at once, is like reaching out to organizers for events and just making sure that they have naloxone present. I think Chief McKern mentioned a lot of events going on in Quilcene, and I know the Herbal Fair is also that weekend, and I can't be there, but I reached out to the organizers that are have the first aid tent at the Herbal Fair, and I'm going to set them up with some naloxone just to make sure that they're prepared if they need it.
I have donated some supplies for the organizers of the Reunification Day. So some first aid supplies, and we could put some naloxone in with that, Lindsay, if you want to. Yeah.
Awesome.
It's a very informal donation. Yeah. But yeah, we could put naloxone in with that also. So.
Great.
Thanks for mentioning it.
And yeah, just lastly, I want to encourage folks to please circulate that flyer and to please promote this community gathering and chance to be together. And yeah, and if folks have questions, just reach out.
Absolutely. Thanks so much, John. Yeah. And then Siobhan, so now my question is, do you want me to have you share, do you want me to let you share your screen, or do you want me to just scroll down and go through the slides this way?
Why don't I share my screen?
Okay, sounds great. I'm going to stop sharing.
Okay.
There we go.
All right. See if I can. All right. Is that it's not in slide mode yet. All right. Can people see my slides? Yeah. Okay. So as I said in my introduction, my name is Siobhan Brown. I am a senior program manager on the Health Systems Innovation team at Community Health Plan of Washington. We also go by CHPW. That is we're one of the 5 Medicaid managed care organizations here in Washington State, and we operate in the Salish region, including Jefferson County. And Lori asked me to come today and talk about the Medicaid Transformation Project 1115 waiver. And the programs that are being proposed. So this is a renewal of an existing waiver that the state of Washington already has, and the programs that are being proposed for this waiver, and it is in a federal public comment period status right now, so there is still time for organizations and individuals to comment on this waiver before it is approved. So she wanted to make sure that this was raised to your group before the end of that federal public comment period. I will do my best not to be super policy wonky in my discussion, and apologize for any background noise. We have lots of activities going on in my yard today that I wasn't expecting. So apologies for that. You have these slides in the packet that Lori posted before the meeting. And so I do always include a list of acronyms because we love our acronyms so much, that I did include that for you. And I'll do my best to not use the acronyms when I'm speaking, but I did want to highlight within these slides that you'll see HRS, which is health related services, and you'll see in lieu of services. Those are the same thing in this waiver. I'll explain more about them later, but where you see HRS/ILS, it's the same program. Healthcare Authority has decided to use a name different than what most people are used to. So I'll talk more about that. So sorry, and my cat also loves Medicaid, and every time I say waiver, she shows up. So apologies for that. So just a little background on most of you are familiar with Medicaid. It is the health coverage for eligible low-income adults and children. It is administered as a partnership between the states and the federal government. It has many federal requirements and is jointly funded by the federal governments and the state. So in Washington, Medicaid, you may also know it by its other name, which is Apple Health. And so you'll see Medicaid alternately referred to as Apple Health here in Washington state. I just wanted to provide a brief summary of what Apple Health enrollment looks like within Jefferson County. And so there are two parts of Medicaid. One is managed care. Most people in Washington state who are enrolled in Medicaid are enrolled through managed care. They receive their insurance through one of the 5 Medicaid managed care organizations. There are some people who are eligible to enroll in Medicaid through what is called fee-for-service, that is administered directly by the Healthcare Authority of Washington state. So that's a smaller group of individuals, but still over 300,000 individuals in Washington who are within the fee-for-service category. It's about 1,500 within Jefferson County. I do want to point out that the current enrollment in Medicaid statewide is about 15 to 17% higher than it was pre-COVID. And so I would expect that when the public health emergency is ended and we go through what's called the public health emergency unwind, those numbers of Medicaid enrollees will again be reduced by about 15 to 17% because they will start going through a process of reconfirming eligibility, which they have not done during the public health emergency. So I would expect to see a drop as people's eligibility is reconfirmed at the end of the public health emergency. This is my plug for those of you who engage with individuals in Medicaid to make sure that their information is up to date with the state health benefit exchange and enrollment system, because the Health Care Authority is going to start sending out notifications very soon about re-enrolling in Medicaid and eligibility and those kinds of things. And so we wouldn't want people to be dropped from Medicaid because they didn't respond to the required notifications that they have to provide their eligibility information again. So within Jefferson County, you tend to have more adults and older adults enrolled in Medicaid than children, and including more adults over age 65. So an 1115 waiver is just a terminology for Section 1115 of the Social Security Act, which gives the Secretary of Health and Human Services the authority to approve experimental pilot or demonstration projects. And so Washington State had an 1115 waiver application approved in January of 2017. And it was initially a 5-year waiver and was supposed to end December of 2021. But because of COVID, a lot of things got delayed. And so the state of Washington received a 1-year extension, which lasts until the end of 2022. So the Washington's waiver allows the state to waive certain requirements of Medicaid. I do want to point out that the waivers must be budget neutral. And that means that you can't spend more money than you would have without the waiver. And that's not dollar for dollar, but that's more like overall cost trajectory, but it cannot spend more money than you would have without a waiver. So the state of Washington has decided to renew their waiver with the Center for Medicaid and Medicare and Medicaid Services at CMS. The renewal application was submitted to CMS on July 15th of this year. There was a state public comment period in May and June, which some of you may have submitted comments for, but it is now open at the federal level for comments. So there's still opportunities for people to provide input directly to CMS on the items that are outlined in this waiver. The waiver will be, if approved, it will be 5 years, and the Healthcare Authority is looking to have it approved by January 1 of 2023, and then it would run through 2027. So I just wanted to point out, as I said, the federal public comment period, there is a link in this slide deck. I don't know if it worked in the PDF that was posted online, but I can certainly share the link for the federal public comment period, which runs till the end of August. So right now, CMS is reviewing the application concurrently with the federal public comment period. This fall, they'll begin negotiating with the Washington State Healthcare Authority. Those negotiations may change some of what is written down in the waiver application. And as I said, that has an expected time frame of January 2023 through December 2027. CMS may not approve everything at the same time. They might approve some things right away to start in January, and they may continue to negotiate with the Healthcare Authority for a number of months. This is currently happening in California. They just had a waiver, 1115 waiver renewal. And while the majority of their waiver renewal was approved on December 29th of 2021, there are still items that are being negotiated between California and CMS. So it is likely that some things that Healthcare Authority has proposed within the waiver will not be approved at the outset. But Healthcare Authority would like some of the programs and services that are proposed here to launch in 2023. They don't expect everything to launch on January 1st. They expect to start launching things probably in July, unless it's an existing program, and then that would just carry over from this year. I'm not going to get too much into the details of the goals. They are calling this new waiver 2.0. Truly, they are calling it waiver 2.0, so I will refer to it as that. But the first waiver and the second waiver have generally the same goals and aims around ensuring equitable access to whole person care, building healthier communities, paying for integrated, that's physical and behavioral health integration, and equitable value-based care. So those goals and aims are fairly consistent across the last waiver and the new waiver, but I do want to point out the current waiver, which ends at the end of this year, is more focused on clinical care and clinical and community linkages, while the next waiver has some clinical elements, but is largely focused on meeting social needs. So I just wanted to highlight that as a major difference between the two waivers is there's more of a focus on social needs within the next waiver. So Lori asked me to go through what was in the first waiver and the second waiver as a comparison. And really quickly, the first waiver had 5 programs they referred to as initiatives. The first initiative was transformation through accountable communities of health and Indian healthcare providers. Some of you may be engaged with the accountable community of health in the Salish region, that's the Olympic Community of Health. and Celeste Schoenthaler is the executive director of the ACH, and that is where I met Lori. It was at the board meeting for the Accountable Community of Health in the Salish region. That was a lot of work for ACHs in that first initiative and Indian healthcare providers to really focus on system strengthening, care delivery redesign, and prevention and health promotion. So there were a lot of projects and programs that the ACHs could choose from to undertake with the support of their and input of their communities. And then the ACHs also ended up doing a lot of things they didn't expect because of COVID. They ended up managing a lot of PPE, gathering and distribution, helping organize vaccine events, helping to provide education. And so there's a lot of other things that were beyond the information indicated in the waiver that the ACHs ended up undertaking. The second initiative, which is managed actually through ALTSA, which is Aging Long-Term Supports Administration under the Department of Social and Health Services, supported Medicaid alternative care and tailored supports for older adults. These were programs to help caregivers and individuals who were qualified but not yet enrolled in Medicaid. And then Initiative 3 is Foundational Community Supports. That's been another important program for Washington State. That the two programs within Initiative 3 are supportive housing and supported employment. The funding from the waiver does not pay for employment or housing. It pays for the supports needed to help certain individuals be able to retain their housing and retain their employment. So there are certain eligibility criteria which are related to behavioral health conditions, age, and other chronic conditions that makes it difficult for them to retain stable housing and employment. And then there were two initiatives that were added late in the waiver that were substance use disorder, IMD, and IMD is an institution for mental disease. These are facilities that have 16 or more beds that are largely focused on providing mental health treatment. These kinds of facilities cannot receive federal funds for Medicaid. So the initiatives 4 and 5 allowed federal funds to be used for SUD and mental health treatment within these IMD settings. So all of these are carrying over in some way into the new waiver. And those are, so the new waiver is broken down into 3 goals. The first goal is expanding coverage and access to care, ensuring people can get the care that they need. So the first sub goal under there is continuous enrollment for children ages 0 to 6. We see a lot of individuals churning on and off Medicaid. It creates continuity of care issues. So the state has proposed to the federal government that we be able to, once a child is eligible for Medicaid, they be able to stay on it regardless of their parent or guardian's income changes. So the child could stay on enrolled in Medicaid until age 6, even if their family income increased beyond the eligibility for Medicaid. This would really support a lot of individuals to stop that churn and really support continuity of care. A big item that will be new, California has already embarked into this space, and this is one of the things that's still being negotiated with CMS for California, is a waiver of the federal inmate exclusion. So when an individual is incarcerated or is receiving treatment at a state hospital or one of these institutions for mental disease, they are suspended from Medicaid or terminated. In Washington, it's individuals are suspended, but they cannot receive any Medicaid funds for their health care while they are incarcerated or confined in any way. So California has requested that CMS waive the inmate exclusion for California. Washington has followed suit. I think that the Centers for Medicaid and Medicare are very interested in this, but there's a lot of challenges to removing the inmate exclusion. So that's a big point that CMS and California are negotiating, and I see that same sort of negotiation happening with Washington coming soon. So what this would do would be to prevent individuals who are incarcerated or otherwise confined and this would apply to individuals, youth in juvenile rehabilitation and juvenile incarceration settings as well, would prevent them from being suspended from Medicaid if they were incarcerated for less than 30 days. But also it would re-enroll them in Medicaid. If they were incarcerated longer, they would be able to regain their Medicaid benefits at least 30 days before they are discharged from that setting. It wouldn't cover everything, probably wouldn't be all health benefits, but it would provide a lot of support around coordination of reentry supports, potentially provide physical and behavioral health assessments, lab work, case management, care coordination, medications for opioid use disorder, and some and prescriptions within that last 30 days of incarceration or confinement. So hopefully that is something that will be a successful request that they are making of the federal government. Expanded postpartum coverage. This is to expand postpartum coverage up to 12 months after the end of a pregnancy. While this has occurred for many populations in Washington already, there are a couple of populations who couldn't be included in that without a special federal approval. And so they're requesting expansion of postpartum coverage for a couple more populations of individuals who were not enrolled in Medicaid while they were pregnant, but were eligible in the postpartum period. And then some individuals who are eligible for US citizenship, but may not be US citizens at this time. And then as you can see, goal 1.4 is that SUD and mental health IMD items from the first waiver. So that will carry over with no changes. The second goal of the waiver is advancing whole person primary preventative and home and community-based care. So you can see those Medicaid alternative care and the tailored supports for older adults, which I mentioned in the previous waiver or the current waiver, which was Initiative 2. And then there will be some new programs called Program Innovations for Long-Term Supports and Services that LTSS is Long-Term Supports and Services. This again will be managed by ALTA, but they are requesting some eligibility changes as well as possible rental subsidies, in addition to addressing some issues that we have within the state of Washington around guardianship, which people can languish without a guardian for long periods of time, and it takes a long time. So there's some activities there under Program Innovations for Long-Term Supports and Services that will be really great for individuals who are engaged in those programs. And then goal 2.3 is an integrated care assessment. Currently, under the current waiver, all the accountable communities of health are required to carry out an assessment of integration within physical and behavioral health care settings. Called the MEHAF. It's the Maine Health Access Foundation assessment. Managed care organizations are also required by the Healthcare Authority to carry out assessments of integration. So the poor healthcare providers in the state were doing possibly 6, 7, or 8 assessments. And so we did beg Healthcare Authority to let us just have one. And so the Healthcare Authority, the Accountable Communities of Health, and the managed care entities have come together to develop a single integrated care assessment that will be required of all physical and behavioral health care providers who are participating in Medicaid. And so that will be goal 2.3. And then accelerating care delivery and payment innovation focused on health-related social needs. This is really that major focus on addressing social needs that was largely missing from the first waiver. So goal 3.1 has actually several activities underneath it, which is it's called Taking Action for Healthier Communities. This is where you will see the focus of most of the accountable communities of health in Washington over the next 5 years within this space. The Healthcare Authority intends for each region to have a community care coordination hub, which is, we call it care traffic control. It's to help coordinate community-based care coordination and coordinate the coordinators. It's to see if when people have needs, assess what their needs and goals are, refer them out to a community-based agency who can provide that care coordination for them. It's not clinical care coordination, it is related to social needs. The state has also proposed a single native hub for American Indian Alaska Native individuals. It could be utilized by the 29 tribes and the urban Indian health care providers for any American Indian or Alaska Native individual, not just those who are enrolled in tribes that are within the boundaries of Washington state. And there would be a single native hub in that case, and then 9 community hubs, 1 for each ACH region. There is a program called what's called health-related services. Within the managed care contract, there's allows us to provide what's called in lieu of services, which are services in lieu of those that are covered by Medicaid, which are medically necessary and cost effective, but they may not be covered by Medicaid itself. So we can ask the healthcare authority to approve services for an individual that aren't covered by Medicaid, but would, in the case of that individual, be medically necessary and cost effective. These, by federal regulation, are not available to individuals enrolled in fee-for-service. So the healthcare authority is proposing that there be a list of 14 in lieu of services, also called health-related services, that would be available not only for individuals in managed care, but also who were enrolled in through the fee-for-service side of Medicaid. So it would be available to everyone enrolled in Medicaid if they meet the eligibility criteria, not just those who are enrolled in managed care. And I'll show you a list of those proposed services in a moment. The healthcare authority has also asked the ACHs to be the managers of some regional equity investments. So they will receive a pot of funds to work with their communities and determine how those funds will be invested at the regional level to support equitable care and overall health equity within the region. And then the healthcare authorities also asked the ACHs to undertake work related to the community-based workforce and help working with MCOs to develop a payment model to help pay for that community-based workforce that's so necessary, but that we currently don't have structures to pay for consistently across Medicaid. And that's not just community health workers. I do want to highlight, because this is a group of individuals interested in behavioral health, that this also includes peers, but also could include doulas, patient navigators, and others. The healthcare authority was very loose in their definition of community-based workforce. So not just community health. I know people always think of community health workers as the primary one, but this could include a variety of different individuals, including peers. And then the last item is foundational community supports, which is, as I noted, with Initiative 3 in the current waiver. This will be carried forward as is, but with some minor modifications to eligibility. It'll reduce the age of eligibility from 18 to 16 for certain programs, and then add individuals who are exiting incarceration as another population that would be eligible for foundational community supports. So it's the same program, but with some changes in the eligibility requirements. I just want to point out that the ACHs and the Indian healthcare providers really would be focusing on Goal 3.1 and Goal 2.3, which is the integrated care assessment. And while they won't be managing foundational community supports or the reentry program, that community hub will really play a key role in supporting individuals exiting incarceration, as well as individuals who are eligible for foundational community supports, and helping connect them to those services. So just wanted to highlight that there will be connections from that hub into other parts of this waiver program. So there's a lot here. I know it's a lot of different programs, but each one of them is extremely beneficial for the individuals in Washington state. So I wanted to highlight these opportunities to you so that you can start thinking about how they would support the individuals within your community. As I mentioned in that goal 3.1.2, there was the in lieu of services, which are in health-related services, which is that the healthcare authority would approve for groups of eligible individuals, both in fee-for-service and managed care. The healthcare authority will set the eligibility criteria for these. So it's not everyone in Medicaid that would be eligible for these. It's not, different populations of people would be eligible for these services. So for example, medically tailored meals and medically supportive foods And this could also include things like fruit and vegetable prescriptions and other things, not just the meals themselves. These would be, for example, the Healthcare Authority has set a list of criteria around chronic conditions and certain times during people's lives, like, for example, post-hospitalization, when an individual would be eligible for these services. And then there's medical respite for individuals who, often we think of this as something for individuals who are homeless, but would also, the Healthcare Authority has set that eligibility criteria more broadly to individuals who need support following a hospitalization. Perhaps they live alone and don't have someone to take care of them. There's also housing transition navigation services, housing tenancy and sustaining services, and housing deposits. These are very similar to what's in foundational community supports, but these would be for individuals who are not eligible for the foundational community supports program. Nursing facility transition and community transition services. These are not payment for the assisted living or nursing facilities. These are payment for the care coordination services that are required to help someone transition, the application, all the paperwork, the connections between the facilities and those kinds of things. Stabilization centers, many of you know them as sobering centers. The Healthcare Authority has renamed them within this waiver application. Rehabilitation programs, these are, I think the Healthcare Authority has defined the eligible population for these rehabilitation programs as individuals who are currently homeless. California has a similar program. They have defined the eligibility criteria differently. So states are sort of proposing similar sets of services, but with different eligibility populations. Caregiver respite services are pretty self-explanatory, personal care and homemaker services, and then environmental accessibility and remediation. This is for maybe individuals who need a wheelchair ramp or individuals who need home modifications like mold remediation and those kinds of things because of asthma. So this is what Healthcare Authority has proposed to the CMS for these in lieu of services or health-related services. Same sets of services were proposed by California. They were approved. As I said, California may have selected different populations of eligibility, but same sets of services. Because this is a group of individuals who is keenly interested in behavioral health, I just wanted to point out some different areas where the waiver would support behavioral health needs or has a focus component on behavioral health. Reentry, the SUD and mental health IMD sections, the integrated care assessment. Some of the in lieu of services and health related services are for individuals or focus on individuals who have significant behavioral health needs. Community-based workforce, particularly around the inclusion of peers in that expansion of community-based workforce and payment structures for the community-based workforce, and then foundational community supports. So all of these areas really have a behavioral health focus or behavioral health component. So I just wanted to highlight them to you all. And then wanted to chat a little bit about the community information exchange. This is not technically part of the waiver itself because the Healthcare Authority is looking at a different funding source. But I wanted to point this out because the Healthcare Authority is currently gathering information on a landscape assessment that is due to the legislature in weeks, but they are still taking responses to their survey. So if you have not had an opportunity to give input on a community information exchange, I can give the link to the survey, but you do have to fill it out before Monday because I begged them to keep it open until Monday and they said they would. So they were about to close it today and I said, no, keep it open. So the state is looking at strategies around community information exchange. This is not for exchange of health information that would be protected by HIPAA. This is more exchange of, there still are HIPAA components, but this would be health information that is more related to social needs and connecting people to social services, closed loop referrals. So when an MCO makes a referral out for for example, to a food bank, we want to know that the food bank accepted the referral and has served the individual, but sometimes we don't hear back. So providing closed loop referrals to services. And so the state is currently looking at strategies to address community information exchange. Some states have gone the way of imposing a single community information exchange statewide, and some have tried to create aggregators of information into systems where it would pull from multiple CIEs or community information exchanges into sort of like a cloud where someone could go and look and say, okay, Jimmy has received a referral to a food bank and it was responded to, and see kind of what kinds of needs an individual has or have been responded to through this more of an aggregator. And some have chosen not to engage in community information exchange at all. So currently, the Healthcare Authority is hoping for both some state and federal funding, but the legislature said, first you need to do landscape assessment. So right now they're doing that landscape assessment. They would like to wrap up their survey by Monday and get the landscape assessment completed and submitted to the legislature within the next 2 months, because they'll be asking for funding in the next legislative session. So I just wanted to highlight that this is an underpinning of a number of waiver activities like that community hub, that sort of coordinator of care coordinators strategy that is being proposed within the waiver. So I wanted to highlight the importance of this CIE. Many of you may use a CIE. Many of you may wish to use a CIE and not have funding for it. So this is really an opportunity to have your voice heard by the Healthcare Authority and their consultant partner, McKinsey, on this landscape assessment, so they can make a proposal to the legislature about what they would like to see for community information exchange for the state of Washington, whether that be a single system, whether it be an aggregator of information, whether it be 9 regional systems that are managed by the accountable communities of health. These are all opportunities for your comment, and I can share the survey link. But as I said, you have to fill it out right away. So I apologize for that, but they just let us know that the survey was closing imminently. And then the last thing I wanted to highlight for you is if you would like to participate in the federal public comment period, it lasts until the end of August. And so the link is within the slide deck. I can also provide a link within the comments or email the group. But I did want to share that there are 2 items on the CMS webpage under Washington State that currently have a pending application, view, submit comments, and just make sure you choose the one that says July 15th, not the one from January 2021. That is an old application. But it would be excellent to have you all review the application and provide comments if you believe that there is something within this application that you want to elevate to CMS, either because it's really, really great and you want to make sure they support it, or because it's really, really bad and you don't want it to go ahead, or you just want to voice your support for the waiver itself. You can also engage with the Olympic Community of Health, which is your local ACH, and specifically regarding the integrated care assessment and the taking action for healthier communities. Those are the specific activities that are within the purview of the ACH. I'm also happy to connect you into other areas of the waiver where you can provide insight and comment, or getting involved if you have other areas of the waiver that you're interested in but aren't under the purview of the accountable community of health. So I know that was a lot, but I am glad that I had the opportunity to come and speak to you all, and happy to answer questions. Also, happy to provide the link to the surveys or the federal public comment period.
Thank you, Siobhan. Go ahead and yes, put the link in the chat for people. I think that the link is definitely in the slide deck, and I believe that it's live. I'm on a different platform, and so I can't check that right now. But I think it is live. But if it's in the chat, that would be awesome too. Does anybody have any questions for Siobhan? Particularly interested in this housing supports, and also the supports for the postnatal women and yeah, the expansion of Medicare benefits for people who are incarcerated for short periods of time. But anybody else?
Well, thank you all. I will put the information in the chat about links to the CIE survey and the federal public comment period, and then I will quietly depart. But it'll take me a second to get those links into the chat.
Thank you. Thanks very much for all this important information. And so then I'm going to move on, and I'm just going to mention briefly that our PIMS data report is due on the 30th of September. And so there are data points that all of the members of the BHC turn into, it used to be Lori, and now it will be Apple Martine. And I will get her email to you. And then I also want to let everyone know that there will be a posting soon for this position. It's going to be impossible to fill Lori's shoes completely, but we're going to do our best. And then I want to say that we're very, sorry that we did not receive the latest funding for the proposal that we wrote to the HRSA Foundation group. But we did get a 92%, which was a really high score, 92 out of 100. So 26 people got higher than we did out of the 400 people who applied. And what they noticed that we were missing was, some explicit language around how this was going to improve behavioral health outcomes and reduce SUD use, SUD problems in our target community. And so we do believe that all of the information that we did send to them is still pertinent, and we can still obviously use all of those data points and all of our narrative to apply for something else, should something else come along. And which there's always other things there that we can apply for. So while we did not get this funding, we are not giving up hope that we can use all of this work that we did to garner different funding. We've got like 2 minutes left. Anybody have any thoughts, questions, or anything that they need to communicate, and I can pass on?
Denise, this is Gabby. I was a little bit late logging in, and I just wanted everybody to know that our mobile unit is officially going to start on Monday. So we'll be at the Coolseen Fire Department from 9 to noon, Monday through Thursday, and then move on to the Brennan Fire Department from 1 to 4, also Monday through Thursday.
That's great, Abby.
So
Gabby, and I have I have flyers. I've hung up flyer in the lobby of the health department, and we'll distribute those flyers to all of my contacts.
awesome. Thank you.
Yeah.
Could you email those flyers around so that we can share them as well?
Yep.
One of you, either Gabby or.
Yes, I will absolutely do that.
Thank you. I would like
Yep.
to share that with folks as well.
Okay. And it was Holly who sent them to me. So just to let you know who's spreading it around already. Gabby.
I trekked out to Brennan and Coolseen earlier this week and put flyers up everywhere that I could.
I'm guilty. I sent them out.
Thank you.
You bet. We'll see you Monday.
This is Jolene from Salish. If somebody could send me one of those, I think that would be helpful. I can send it out to our network as well.
I will definitely send those out, Jolene.
Thank you.
Hey, Gabby, real quick, you might put a start date on there because there's no start date on them. If you got a chance and you got the original, there's no start date on that, so you might do that because there's no date on it.
All right, I will add a date. Thanks.
Okay, thank you. Anything else? All right, everybody. Well, thank you very much for being here. Thank you for being patient with me. And, you know, we're going to keep trudging forward. All right. Thank you. Until next time. Bye-bye.
Please, thanks everybody. Good to see you.